happen.
Okay.
What's that? Oh, Tom.
Okay.
Okay?
You know, Yuki?
I don't know. What are you doing? What's wrong?
Carol, what did you learn?
I had Apoquel. I learned that it can start working in as little as 4 hours. And the scary thing was that like it can aggravate any neoplastic conditions that might already be there.
Okay. All right. Sherry, which one did you have?
Apoquel.
Good. What did you learn about it?
About the jacks, like that was interesting, like just learning about that more. I guess one of the things with the negative with it is just like the whole thing with cancer that it's talking about, that it can create an issue with cancer. And that was like the big thing on the naturally one that they really get upset about is like, it basically can cause cancer and.
Very fine.
Asthma.
Amanda.
We had Cytopoint. Definitely advertise it will work within a day. Like you'll start seeing improvement within a day. Google's a scary place.
Yeah.
There was a holistic vet on there ranting about how Cytopoint's gonna kill your dog.
Okay. Okay. Vanessa.
I also had Cytopoint, and kind of like Amanda said, it is effective within 24 hours, and it controls itch in 73 to 88% of dogs. And I thought it was cool that it's as effective as cyclosporine, with the less side effects. But then, like Amanda said, it's scary and it supposedly kills dogs and causes a whole bunch of other diseases.
Okay. Heather. What did you have?
Apoquel. I think the Jax thing again was interesting. I had never been actually really explained that, just it was supposed to work. And the fact though that you can't use it in Demodex dogs, which would be like, I would think a go-to. One to stop the itch.
Yeah.
And scary thing.
Mm-hmm.
Did you have a scary thing you learned?
Yes, it can't be used in under the age of 12 because it does affect the growth.
Under the age of 12 years.
12 months.
Yeah. Okay. Anna.
I had Cytopoint, and I thought it was interesting that it only helps some dogs, and some dogs can experience like longer relief and some are shorter. And then online we found some scary things that people were saying that it causes autoimmune diseases and it, like their dogs end up dying from it and stuff like that.
Okay. Paulina.
I guess interesting, like anecdotally they said after the 2 weeks some people split the total dose into 2, which I didn't know that's a thing that people do.
Okay. Scary thing.
I guess just everywhere online, like people don't like Apoquel and they're
Yeah.
really against it.
Okay. Katie.
With Cytopoint, it's safe to use with any age and with other diseases. So it says, and then Liz and I looked and there was like a holistic thing that said that those
IL-31s.
yeah, are not a one-trick pony, and that by blocking them, it causes other issues.
Did they have any like what their other ponies were?
No.
No, they did not.
I had Cytopoint, and kind of piggybacking off of that, it basically said it just covers up the itching and it ignores the root cause of it. So, yeah.
And what did you learn about it?
I focused on the negative, not My insurance took over my dog has been in the past like 4 months for it, so.
Okay.
I did
You know what, I'm gonna give you a bye, cause that was an honest, good answer.
There's only one study, I don't know if this is true, but I saw it a couple times, there's only one study performed and it was sponsored by the company.
I'm sure that was a negative also.
Only doing negative today.
Okay, Liz. I thought it was interesting. It's a caninized antibody, so it will not be likely approved for cats. And then
This is Cytopoint.
this is Cytopoint, yeah. And then it you can use it in conjunction with other treatments for itchiness, other antihistamines, and steroids if needed. And then the scary one thing I thought, it says that it's possible that their bodies can produce antibodies against the product over time, but then on their website it shows that the efficacy gets better with multiple shots. Alright, so I'm gonna read,
Up to what, the third? Is
to
it the
you.
third that
Yeah.
it gets the maximum effect?
I'm gonna read this to you from this person's talk, and we'll kind of talk about it as we're going through it. Say, so when they're creating, one thing, this is genetically engineered technology here. They're working on the genetics, they're working on a cell level. So the two things that they try and do when they're doing that, the two criteria that they have to meet, is how similar to the genetics of the patient that's receiving it can they get, thus preventing allergic reactions to the product. So how safe can they make it? And that's where the canonized comes in. So Cytopoint is greater than 90% identical to the canine antibody, which decreases the risk of allergic reactions. So it's been canonized for that. That's what it's called. Then the other thing that they're looking at when they're kind of developing these products is their evaluation of what the target is. So are you going to hurt or help by affecting the mailbox or affecting the IL-31? So what they're looking for are what are the possible negative side effects from decreasing the efficacy of the target antigen. So by decreasing that IL-31, are there negative side effects to it? So the example is many cytokines have both positive and negative roles in inflammation and immunity, which is where they're talking about the one-trick pony. So an example is Humira is used in the treatment of several diseases in humans: psoriatic arthritis, Crohn's disease, rheumatoid. You've heard of Humira, I'm sure, on ads. By decreasing a specific it's decreasing another one of these. Dampening that helps with the treatment of these diseases, but that modulator in humans also plays a critical role in effective immune surveillance. So there's an increased risk of infection. So Humira is another example of one of these, but it doesn't happen to be as specific for in this case that they're saying for IL-31. So Cytopoint's target antigen is IL-31, and it has no recognized activity in dogs other than the induction of neuronal itch, so no known negative side effects. They don't think it has any positive side effects either, so it shouldn't affect the dog either way if they have it or not. Now, I don't disagree. I very rarely think God makes things that have one purpose in life. So I'll tell you, kind of addressing that, I could buy that there's something else that IL-31 does. I think it's beyond my mental ability to understand the genetics and the molecular level of this. However, I think that risk-benefit, people having itchy dogs at home drives them crazy, and them being in a shelter or being dead because they aren't getting the treatment for their itch, probably better than even maybe losing a year of life, and their life expectancy is 10 to 15 years in the first place. So maybe blocking IL-31 would cause problems if you live 50 years because X, Y, or Z would happen. But I think in our dogs' lifespans, it's not causing major issues. So kind of goes along with that trust thing. So that's that. Okay, so Cytopoint therapy, advantages and dosing. So it's a highly targeted, it binds the IL-31 in the extracellular space, so in your blood. And it makes it so the IL-31 can't bind to the cytokine, to the receptor on the cell, the mailbox. It mops it up, essentially. It does not involve the kidneys or liver to metabolize it, and it can be used safely in patients with liver kidney disease. There are no known drug interactions because all it's doing is binding that IL-31, and it does not interfere with allergy testing. I don't know why. So the gold standard in the past for allergies has been to go and get skin test. How many people here have had skin testing done? Has anybody? I have. Oh my gosh, I'm the only one? Seriously?
My son had it done.
So skin testing is basically when you go to the dermatologist, or the allergist I should say, and they take like 2 million needles, not really, but probably a couple hundred. They dip them in, it's like a grid of like 20 by 10, and they dip them in these liquids, so there's needles with this little drop now on them, and then they stick it on your skin, on your back or on your forearm, and then they make you sit there for 10 to 15 minutes, and they see which ones get big. And then they grade them, and then sometimes they go back and they inject some of them then under your skin based on your response to see if you get red or whatever. And that's how they tell you what you're allergic to. Dust, cockroaches, mold, cats, dogs, anything non-food. So that is what skin testing is, and it's extremely good real world way to see what an animal or a person reacts to. Then what they do is they go back and they make vaccines or injections for you with microscopic doses of, for me it was like cat, and there's an increasing amount in it every week, so it's below your threshold of recognizing it, and then your body starts developing an appropriate immune response to it, and then theoretically over time you don't have the inappropriate allergic reaction because your body has learned the proper way to do it. It's kind of like going back and learning the basics ABC, and then now you can read as opposed to jumping in at the end where you're given a novel and said read it. So that is the gold standard even in dogs and cats, that they can do that, and it's I think about 60 to 70% effective with those injections that owners normally give at home at treating canine allergies. The expense is probably, let's say, $500 to $700, including 6-month vial of the injections. So it's not exorbitantly expensive. So one thing kind of to jump off track here is when you hear me talk about these allergies in younger animals in the room, a lot of time I'll be like, your dog's 1.5 years. I mean, we don't want to commit to giving a Cytopoint injection every 4 to 8 weeks, year round for the rest of your dog's life. Like really, you should be going and trying to get to the underlying problem, which is where that was being discussed, that you're just kind of covering it up. Like you need to go and teach your body a new way of handling it, or you need to deny exposure to whatever it is. But guess what? Cytopoint's easy, and people like it. And so it's hard to get people to go get allergy injections in a good day. But I wouldn't say that I'm having any less or more with Cytopoint, and the dermatologists still use Cytopoint to help with the symptoms while they're doing the testing. Okay, so that's allergy testing. That's the gold standard. That's ultimately what we would do to get them off of the Cytopoint or Apoquel. So I don't know why it doesn't interfere with allergy testing, I'll be honest with you, but it doesn't. Other key here, food allergies. You hear people say, oh, I got to test for food allergies. You cannot test for food allergies. You can only do a food trial. And the reason is that it's not reliable injecting it in the skin because it's your gut that absorbs it. It's just not, it's like apples and oranges. So you could get a reaction to apples, but then how your gut, it's like you need to see what it's doing in your gut. So that's why you can get false positives and false negatives with any sort of testing for food allergies, because you can't test the area that's actually dealing with the insult. Okay, so no drug interactions, high safety profile because it is canonized. They don't tend to have reactions to it. Going to one of your other issues here, that they die. So funny thing, I'm reading on my DVM Mom's Life in the Trenches, voila. And yeah, lots of people have had dogs have reactions to Cytopoint. Like literally, yep. First one I gave it to dropped dead on the needle.
What?
Yeah. Okay, now once again, that is still the exception, not the rule. Knock on wood. But like any injection, you can have a idiosyncratic, which means you can't predict it, there's no rhyme or reason to it, there's nothing you could have done to prevent it, it just happened, reaction to it, just like to a bee sting. So yes, so technically we should be telling clients, hey, this is an injection, there is, always some chance a pet can have a reaction to any medication, injection or not, while it is considered extremely safe and it is extremely rare, there's a risk with any medication. Okay, so
So
but
is
it does happen.
more likely to happen like right away than like a reaction that happens long
It seemed like most of the animals were having an issue within like the first
Okay.
12 hours. And it would be like your classic allergic signs and or like diarrhea, vomiting.
Yeah.
But it's extremely rare. I mean, I was like, whoa, okay, kind of scary there. Okay, so safety studies demonstrated no so the safety studies showed no difference in adverse events between drug and placebo. So once again, that goes against that, but you can have a reaction to anything. Although I wouldn't think you could to saline, but. Safe for use in dogs of any ages, including young puppies, because once again, they figured out that IL-31 doesn't do anything but cause itch. The dose, in Europe, they actually use a lower dose. The United States use a higher dose, with the belief being that we are choosing, it's the length of duration that it lasts. So, but if you look for it, you can dose lower. But you can also dose a little higher safely. So it has to do with how long until it basically can't catch any more of the island. The net gets full and it can't catch anymore is what happens. So basically the dosing is, there is some variability with it. Begins to work within 24 hours, sometimes before. Sometimes you'll see me give Apoquel, give a dose of Apoquel to the pet and then give him the Cytopoint. Those are the ones that are really itchy, because Apoquel typically can work within 4 to 6 hours. So if I want to just buy some time to get the Cytopoint going, that's what I'll do. The patient variability and duration of clinical response, 1 to 8 weeks. The average is 3 to 4 weeks. You can repeat as needed. If it hasn't helped within a few days, it won't.
But see, that's weird, cause then like on the website, Zoetis' website, it says after like 3 if it doesn't
Yes.
happen on the first time, you should still do more, so that seems weird.
So, and that was a talk I did go to or listen to on Zoetis, and they did say that some of these dogs have to get to a plateau effect with it, so don't give up. I think if it doesn't work at all, and the problem is that it
It's a
goes
hard sell
either
for the
way.
client, too.
It is, but I think what we fortunately see is for some of these dogs, they get so much better, like they're perfect for 2 weeks. I think you can sell them on it, because you could be like, hey, I mean, they like seeing perfection, and if there's a possibility that perfection can still be obtained, it's amazing how receptive they are to it. Itching animals are miserable for pet owners.
I will say Cytopoint didn't work for my dog at all. Like I had no improvement whatsoever, but Apoquel, fabulous.
Yeah.
I know, and didn't you mention once you read an article or listened to something that they even said it works better in larger breed dogs than smaller? Do they
Yeah.
know why?
Zoetis said that also.
Yeah.
Interesting.
Yeah, and there are some dogs that over time will have decreasing efficacy because they do, I think, bind. Either they're probably developing not a reaction. They're developing a response to the Cytopoint and blocking it before it blocks the IL-31. So
Bailey's.
bottom line is, it's a crapshoot. It might take longer for it to work. Might take less for it to work. Normally, what we do is we just switch them to Apoquel and call it good, and we're fine. And some of them we put on both drugs. There are a few patients we have on both.
Does Apoquel interfere with allergy testing?
I don't believe it does.
Okay.
Yeah.
So it was interesting when Liz and I were on Zoetis' website, they actually was like, have a treatment plan, and it basically, you're right, Liz, it listed everything, it's like, do this, but then you make sure they're on some Trios so that they don't have any,
convenient
and then convenient.
Ah.
So they listed a way that you could use
covering all your bases.
convenient, Simparica Trio, Apoquel, and Cytopoint.
Well, that person better sign up for the rewards, I'm just saying.
Yeah. They have, they're like, people do better with a treatment plan. Show them this treatment. I was like, Liz and I were like, oh yeah, every one of their products.
You gotta love them, and none of those are cheap products. Okay, so patient variable product requires refrigeration. Refrigeration does not contain a preservative. So some places actually are dividing vials. You cannot do that with Cytopoint. It does not have a preservative. They also had several people that were said there's pain on injection. Apparently a lot of people see pain with injection, which I don't think we see. I can't remember if it was this one or Serenia. But
Peanut
one
cried
of them
today.
said you want to use the bigger, you don't want to use a smaller
He's
needle
cried.
size because it breaks up the little micelles and it makes it more painful.
Oh,
I think
I
it
was
was
that's
Cytopoint,
right.
'cause I remember you came in that
He
day and
don't
said
like
no more baby
He
needles
don't like
or
anything.
Cytopoint.
Yeah.
Go with the bigger needles.
Yeah, I feel like it was it was relationship to that, but I don't think we noticed pain with injection too terribly much.
So when Cytopoint used to be catty and first came out, noticed a lot of reaction with it, but then slowly haven't noticed it as much. But I also feel like it's a cold injection, like it's like, oh, like that's
Yeah.
cool.
Yeah.
Like I don't think it's like pain, it's more like, oh,
Yeah.
surprise.
Yeah, I just don't feel like we see it as much, but there were quite a few people who said that too. Okay, the disadvantages of Cytopoint is it is expensive, especially for larger dogs. However, it is trade, as is Apoquel. There are no generics available, and Zoetis is raking in the money. I will tell you one of the things that's infuriating about Zoetis is they have, and some of you have heard me complain about this before, they have a proposed pricing for Cytopoint. And it's very generous for them. Basically, they are like, you can keep your price of Cytopoint at this amount for your clients, and it involves basically an injection fee of like $15, I want to say, and then like a markup of like $15 or $20. I mean, it's like crazy. I don't think the majority of people go to that actually look at it and think of that. That's not a business model that works to pay staff. I'll just tell you that right now. So what we have done, we have it as it's a tech. They're paying for a tech fee because it is a tech appointment, and then there is an appropriate markup of like 1.8 or something like that. It's still actually less than would be standard in the profession, but it's an appropriate markup on top of that, and it does drop down for the larger doses. Just to reiterate, I think we already talked about this, you cannot take that tech fee out. You cannot remove that tech fee. It is part of the product pricing. Without that tech fee, it doesn't get us to the point where it's paying for you to give the injection, you to order the injection, you to receive the injection. It's all in there, and the reason we use it is because we're combining markup and we're combining a fee to get to that fairly for the client. 20-30% failure rate. Sometimes it's initially effective but less effective with subsequent injections. If it is not re-administered before allergy symptoms dramatically worsen, recurrent infection may occur during this time. So basically, you cannot treat secondary infections with Apoquel or Cytopoint. So a lot of these animals are itchy because they have a bacterial infection or a yeast infection on top of their itch. So these drugs are not treating the infections, they're treating the itch that then leads to or helps support the infection.
Do you want me to do labs? I can listen while I
Yeah, why don't you start doing them? Okay, when do I choose Cytopoint? When I want to provide immediate, rich itch relief with no age or drug interactions. It may help with food allergies, it may not. We do tend to give it to dogs that have food allergies to buy us some time to help with the itchiness. And then Apoquel failure or in combination with Apoquel is another time to use it. And then to provide relief when starting therapy with cyclosporin. Okay, then we're going to go to Apoquel. Apoquel, we kind of talked about it. So here's the thing. Apoquel causes the downregulation, the blockage of IL-2, IL-4, IL-6, IL-13, IL-31 by infecting this JAK. So the JAK is used for all of those ILs. So that's where you can see it's a more broad spectrum blockage of the issue. The dosing is twice a day for a week, or for 1 to 2 weeks, and then once a day. The reason that is because you can suppress their immune system with Apoquel, because you are blocking so many more letters. So that's why. It is, and I have read this a couple times now, that you can dose it, divided dose. So if they're normally getting 16 milligrams once a day, you could do 8 and 8, and some animals do better with that. But you cannot put them on twice daily 16 forever. Some people do, dermatologists do, but it's with it might kill your dog. So you have to be aware of that. And it's probably not going to kill your dog, but it's going to have, there's no potential side effects. The other thing you can do is you can dose it prior to their itchiest time of day. So if you know they're going to be itchy during the day, you do it in the morning. If they're going to be itchy at night, do it at night. When it is not effective, you can recalculate the dose. So sometimes I'll do that. The dose range is 0.4 to 0.6, so sometimes I'll be at the 0.4, so we'll up the dose to the 0.6. Splitting the maintenance dose, and blah, blah, blah. Okay, the side effects and concerns. You cannot use it in pets yet less than a year of age, not in pregnant or lactating. You can't use it in animals that have Demodex. And if you do, it'll just mean they have to be on the treatment for Demodex longer because it's dampening. All of this is related to the number of letters it's blocking. There is theoretically increased incidence of papillomas because papillomas are viral induced, so the little skin things that dogs get. Some dogs will get more of them when they're on Apoquel, supposedly. It is contraindicated with a history of cancer. Although I will tell you that the study that they did with Apoquel, there was no increased incidence of cancer over pets that were not on it. So it's a theoretical, not a necessarily proven. So it does not cause cancer. They can have possibly a low white blood cell count, which is often transient, and sometimes they can have a little bit of an increase in liver values. I don't know why that is. Vomiting, diarrhea, and increased thirst, urination are reported but not common. And they do recommend that you're doing yearly labs and a CBC. They actually, in this presentation, recommended when you do starting and then at 6 weeks. So I've read also on VIN that they once a year is fine for blood work. We definitely require Apoquel for using, or we require blood work for using Apoquel. We used to require it every 6 months, but then on VIN they kind of updated that. So I'm pretty comfortable with before. I personally am not doing it at 6 weeks, and I'm okay with that at this point in time because this is the only place I've seen that referenced. And then there's a nice little comparison here of what they do, and that is that. So let's now talk about our questions that we were doing. Why would we use one versus the other? I tend to lean towards Cytopoint just because I think based on the science of it, I think it's a safer option. I think that it just, blocking one unknown IL seems better to me than blocking many.
Cost, like, being on Apoquel versus how often you have to get Cytopoint. I mean, are they comparable, or is one?
It's a good question. If the Cytopoint only lasts 4 weeks, I want to say it's comparable. It used to be a titch more, but it's probably about, the text probably can answer
I
that,
bet
but
it's more cost effective is Cytopoint.
The Cytopoint
Okay.
is?
Even for large dogs?
yeah. Apoquel is so expensive. So expensive. Also, a side note here, you should be wearing gloves if you're handling Apoquel, technically. Now, or at the very least, washing your hands. Now, if you read, which I did, I was just reading something on this, if you read the small print on any drug, in the MS and the SDS sheet,
Wear
it says
gloves.
wash your hands.
Oh.
Oh, I have something to say. So the thyroxine tabs that we get, it comes with a sticker that says 1 a day approved by the FDA. We just have to remember to peel that off before
We need to
give it
actually peel all
owners.
those off.
Huh?
Can we peel all those off?
Yeah, so that, I just happened to find, I was looking for something up front and I found that the sticker was still on there.
Yeah.
And I was like, well, we don't wanna give it to them and
Yeah.
our instructions say twice a day and the
Yeah.
FDA says once a day.
And the reason is because there's different ways that you can use it, and sometimes we do use it. It's changed actually. It was always twice a day. Now it's kind of once a day, but then it can be twice a day. Hannah, can you talk to Vanessa and have her show you what that is? And we need to peel all those off. Thank you for reminding me. So yes, so Cytopoint does tend to be more affordable because Apoquel is also very expensive. When do we see improvement? I think we answered that. Typically 4 to 6 hours with Apoquel and within 24 hours with Cytopoint. I think it's more closer to 48 hours, but whatever. Side effects. Lethargy is one that we commonly hear. I personally attribute that to the fact that the animals haven't been sleeping because they have been itching, and so they finally have relief and they can finally actually rest. Animals sleep a good majority of the day. And so if they are waking up, I mean, you know how you feel if you're woken up every hour even. I mean, you're exhausted.
Yeah.
So I think they're finally just getting some good sleep. BID, if it works, we addressed that. Once again, Apoquel, you're blocking a lot more things. I would feel much more comfortable with a Cytopoint overdose than I would with an Apoquel overdose. Why Apoquel versus Cytopoint? How often Cytopoint? Cytopoint is basically based on when they start itching again. The thing sometimes we'll do is we'll send them with some Apoquel to have at home, so that when the dog starts itching, they can just pop them on the Apoquel and they get until they get in for the Cytopoint injection. Other thing to side note here, one of the reasons that we'll kind of require, so several of you have seen some of these recently, like when they haven't been on Apoquel continuously, but I want somebody to see them before we start it. It's because, Kristen's here, can you grab the little glass? Because if they have an underlying skin infection, once again, the Apoquel will not work. It will not treat that. So before I'm willy-nilly starting on, it's kind of like with a Cytopoint. A technician I know is seeing the pet with the Cytopoint though, so I have that safety guard. I don't have that when they just randomly call to come and get Apoquel again a year later. And, you know, for instance, little Peanut back there, I mean, that skin probably needs a little help beyond the Cytopoint at this point in time. Can we use both? Yes, you can, because they do different things. So my guess is that when we have like Stanley who's on both, he's blocking his IL-31, but he needs some help from those other ILs that are contributing to his itch. Why blood work? Talked about that, and there's no need for blood work with Cytopoint because it's not blocking multiple agents. Expensive because Zoetis sucks. And I wish I had invested in them before, because talk about a game changer for our profession though.
Yeah.
Like,
How long
it
does
really
the
is.
patent, how long do they get to keep it?
I want to say like 7 years, 10 years.
So Apoquel might be coming up soon.
Yeah, yeah. And Cytopoint actually was in studies. Jenny Higgins' dog was part of the study group that Dr. Cool did,
Oh.
Dublin.
Cause
Way
I remember
back when.
Dublin used to get the allergy shots.
That's what Dublin was getting Cytopoint.
Oh, that's what she was getting, okay.
And how young? You can do it as young as you want with Cytopoint. Over the counter versus Apoquel. So there are no over the counter treatments for these really allergic dogs that really work well in dogs. And people ask about Zyrtec, and you know, you'll see us say, well, you can try Zyrtec.
Yeah.
It works in about 10 to 15% of dogs, unquestionably at that. I mean, some dermatologists would argue that it's just even malpractice to mention it because it's such a wives' tale.
And
that
they
it
said
works.
on this one, it said basically that they think the drowsiness side effect may be responsible for any reduction in the scratching.
And I think there's a lot of placebo effect for people too. I really do. So I would definitely recommend that less. But if people want to do something and they're not going to do Apoquel or Cytopoint, I mean, sure, they can try it. It's probably not going to work a ton though. Steroids. So steroids, we were talking about, you cannot use Apoquel with steroids or with cyclosporin. And I think it's because you're starting to dance with too much you're just playing with the immune system too much. It might be okay, but they're not sure it's okay. So it's not been tested with those. Cytopoint has. You can see the resounding theme here. And I think once you understand that whole letters and mailbox and IL-31, you can see why Cytopoint is preferential for a lot of these reasons. And it makes a little bit more sense why that is, that you can use it with prednisone or you can use it with the others. And then the written RX, yeah, not happening. I mean, I don't have to write an RX for an injectable.
Yeah.
It won't happen. Now you could argue that Adequan we do.
Right.
And Adequan is kind of a biologic also. And I do think we do need to kind of start talking about Cytopoint with that wording, that it's a biologic. It's a little bit more like a vaccine than it is like a medication, because it is a genetic product that is being used to block a very specific thing. It's not COVID in this case, but it's IL-31. And so it is considered more of a biologic. It's changing the biology of how your body works.
And it needs to be refrigerated.
Yes, it needs to be refrigerated, yeah, is another reason. So I would say,
Yeah, that's true, right?
here is somebody here. Hopefully he's gonna read the directions. Carol, you wanna go see what
They're probably filling
Yes,
them
I have
ahead.
he needs? Okay, so let's look at this real fast. Works with the immune system. Within a day, 73 to 88% effective. Yes, you can use it with cyclosporin. Cyclosporin is another immune drug like prednisone, which has less side effects than prednisone,
That's atopic, right?
atopica, but the side effects can be much more potent.
Oh.
So it is a much more effective at shutting down the immune system, but it doesn't cause you to pee a lot and drink a lot. So more dangerous, less side effects, or potentially more dangerous. What?
The lab guys here.
Oh,
Haha.
Yeah, I just had to put them in the bags.
plus minus plus PDH, canonized with our Apoquel. So I think the negatives for both of these, let's do that real fast. I don't know. I mean, so I think that the tough thing is that I think what all of you saw is it was very easy to see. Like I think this one, many side effects. I think that sums it up. Like you're not even focused on one side effect. You're just like, I was overwhelmed with side effects that they had. All I took home from this was there are lots of side effects. Fortunately, I would argue 95% plus of our, do you have clients ask about, or say they've read things?
I think I've heard them ask me about it and say that they've seen some things about it killing dogs.
Okay,
I was like,
gotcha.
oh. And then it made me a little bit, when reading all the stuff, it made me a little bit nervous about doing like tech appointments when you're not in the building,
Yes.
you know?
Which we have technically gone to, Cytopoint is not given, and I think that there's something to that, but I mean, the other thing is you can argue that with even vaccines.
Yeah.
Which, I mean, we don't talk about that, but you can have an allergic reaction.
But I mean, you Google any medication, you're gonna hear
If you-
negative stuff.
Yeah, if you read the side effects for Advil, it can kill you. So literally, it says on there, like, when I did my vaccine talk years ago, one of the side effects for ibuprofen is it can be fatal. So, I do think, though, that it was good that we went to Cytopoint only when I'm here. And I think for you guys up front, it probably helps you hopefully understand why that's important. Because it is something that, you know, fortunately, it's extremely rare for an animal to drop dead from a vaccine. It's extremely rare for that to happen with Cytopoint too. But I think in light of the fact that it's a little bit more of a drug, it's probably better to keep that obviously
And
how
I
we
think
are.
clients don't have a problem for the most part. I mean, some clients are just, if we're saying, hey, we're gonna do it because we need to, if there's any skin infection, I think they understand it, whether they like it or not, they understand why we.
Right. Yeah. So I don't have a lot for you to say when they have these concerns other than don't get it for your dog and let your dog itch. Meaning they can choose not to do it, but that's just the way it is. I do not prescribe steroids for itch. It's just not, I won't do it pretty much unless it's like like for 2-3 days, like it's a hot spot. And honestly, we use Apoquel a lot for that now. I would tend to say I also encourage people that have those concerns. Oh, you know, hey, if you could get this as a reference for that, you know, we'd be happy to take a look. You know, that'd be good for us to take a look at. But you know, if you have like a document or an article, like, do you have the medical reference for that? Because very rarely, it's kind of like the ponies one. Well, you can say that, but what are you referencing? Are you referencing another website, or are you actually referencing a study that was done by a university with doctors and cases and how many were in it? The Cytopoint study, only having one study done by the Zoetis, I don't know that I doubt that's true. I can't imagine that's true at this point in time, but I will tell you that normally they do pretty big studies. Like, I can't imagine. I'm guessing that even if Zoetis was the only one that did it, it was a pretty large study. And it was dermatologists doing it. It was people like Dr. Cool doing it.
So I know with Cytopoint, you always say you wanna look at the skin and make sure there's no infection. Can you not give the Cytopoint if there's an infection?
You
Or can you
can't.
give it and still treat the
Yeah.
infection?
It's not gonna hurt to give it,
Okay.
but we're allowing owners to self-diagnose that that's why their dog is itching, because it may be that the dog is purely itching because they have a skin infection and it has nothing to do with allergies.
Okay.
Not every dog that's itching, most dogs that have allergies itch, but not every itching dog has allergies. And that's the important thing, is that now most of these people that are asking for it, I mean, they've done it before, they know it's not gonna be an issue. What other questions do you have kind of after discussing this? Do you feel like you understand it a little bit better? Does that help, hopefully? Hopefully a little scientific, but not too scientific.
Yeah.
Okay. So I think the big things for you to take home, do try and wear gloves if you're counting them, or wash your hands. I think that what I did see is conjunctivitis.
No,
What happens is people touch them and then touch their
eyeballs.
eyes. I don't know if that's other drugs or just with this one. And doing it while we're here, and that's why it works. But hopefully that helps.
Yeah.
Okay, so next week we will be doing birthdays on Tuesday, because I did not plan anything today. I kind of feel like I'm in a fog of school starting.
Yeah, right.
I don't know if everybody else is in that fog, but I'm
Heck
just in that
yes.
fog. I'm in that fog of that transition from no schedule to full blown schedule.
Yes.
And next week is when full blown schedule starts. So I think once I get in that, I will be much more onto. But I will plan. We probably will do a potluck next Tuesday, just for the fun of it. We only have an hour-long meeting next Tuesday, and it'll probably be more just say, let's eat and hang out. Maybe if there's something on the board, we'll go through it. But that's that. And then, other than that, any other questions, thoughts, concerns, open items? All right. So, start whatever lunches we have. I'm going to figure out what's for the schedule. Let's see what's going on. And I think we have lunches.
I know Sherry and Kristen have a block, but I only think